Hey, this is Gilly Woodhouse on the Osteo Business Podcast, talking all things osteo business. Here's Gilly Woodhouse, an author, speaker, award-winning business coach, and passionate advocate of osteopathy.
Hello and welcome to this episode where I am talking to osteopath Anna Aydinc. Welcome.
Thank you for having me.
Pleasure. Thank you very much. And we're going to talk about all kinds of things, no doubt, but in particular, lifestyle medicine and how you're weaving that into your practice. So how does that work?
Yeah, absolutely. Maybe what is useful if I paint the picture a little bit how I ended up in lifestyle medicine.
Yeah.
So I have been an osteopath for about 15 years. I graduated from the BSO back in the day. And while at undergraduate level and also initially when coming out of university, I explored different verticals, cranial, visceral, more structural, minimal lever techniques. I dabbled a bit in pediatrics. And then eventually in one of the clinics that I was working, my principal then, shout out to Hazel, was very interested in neuroscience, particularly stress and the impact of stress on recovery. So we deep dived into that in a much grander scale. And out of that interest of looking into stress, I came across figures such as the GP, Dr. Rangan Chatterjee. He's quite a prominent health figure. And reading his various books and looking at his various approaches, he's sort of the advocate for lifestyle medicine and looking at those 6 pillars. So eventually I came across the British Society of Lifestyle Medicine and their annual conference that was happening in Manchester at the time. So I told my old principal, Hazel, and I dragged her along to Manchester, and off we went to this conference. And it was mind-blowing for both of us. Both of us, we went and we were in a room with 2,000 to 3,000 predominantly doctors that all spoke our language. So, I mean, we know about the biopsychosocial model from the moment that we are trained in osteopathy. For doctors, this is a newer approach. And while they are discovering this as a new thing, for us, this is quite old news, essentially. But they had amazing speakers on a variety of different subjects. So I then decided to do the course. So through the BSLM, you can do a course either down the medical pathway if you are a doctor, or if you are an allied healthcare professional, you can do another pathway and you can qualify through that. And I thought when Gilly put out this message about what we're integrating into clinic, that it would be nice to advocate a bit for lifestyle medicine within the profession, because I feel that we can have a huge impact on overall health span and health outcome for our patients. So essentially, the idea of lifestyle medicine is that it is based on 6 pillars. And those pillars are exercise, sleep, social connection, the reduction of harmful substances. So they talk predominantly about alcohol and cigarettes, stress reduction, or our general mental well-being. And within the course, you're being taught various assessment protocols. Everything is research-based, everything is objective, and then you're being taught a variety of coaching techniques. You're being taught motivational interviewing skills at a very basic level, and some that you can then work on exploring some more.
Yeah. Oh, amazing. And
Yes.
and did you start using that right away when you completed the course or during the course, or how did that work?
So without knowing, I had already been using this before the course, because like I said, I had been very interested in stress, and I would ask patients about stress. And I think one of the big light bulb moments for me was actually just before COVID. I had a patient that came into clinic, and he was wearing this device on his chest, and he just made a point like, I will just lie on my tummy and just ignore it. And then all the clinics were closed for COVID, and we did a virtual assessment. And at the end of it, he said, "Oh, Anna, there was something I wanted to show you." So he had been using a device from his work called FirstBeat. And FirstBeat displays data in terms of exercise and stress scores and recovery scores. And he showed me a graph, and he said, like, look at this day. Can you see how the entire day is red? But then there is a 30-minute dip between 5 to 5:30 that is really green, and then it goes red again. And I'm like, yes. And he said, that's the 30 minutes that I spent with you. And it was this moment of seeing objectively the impact that our work has on stress reduction and recovery. And that was the moment where I started to become much more interested in wearable technologies and integrating those wearable technologies with some of these lifestyle assessments that I put together. So within a clinical setting, what I have done, I have put together an assessment tool that is analyzing all the individual lifestyle pillars for a patient and combine that with looking at their objective data. So if they are using a wearable, I would look at what that wearable data says, or I would use a wearable of choice to kind of track their data for a period of time. So in a clinical setting, we can either do a lifestyle assessment as a standalone assessment, or the other option is most of my patients get it whether they want it or not, because it comes up in conversations. So my opening question always tends to be around, what do you do for joy? And then from what do you do for joy, we kind of talk around social connection. We talk a little bit about sleep, about what strategies they have to optimize their work-life balance, what exercise they enjoy. So you get a lot of that information in the background, that you have some ideas on how to coach them, essentially without them necessarily realizing that they're being coached towards better health outcomes.
I love that. I think that's a superb question. What do you do for joy? Because it really stops you in your tracks and makes you think, what do I do?
Yeah.
Amazing. Yeah.
The other question is what I've just done with you. What's your win of the week?
Yes, I knew what you were doing. But of course, I was straight in there. Yeah. Wow, it's brilliant. Yeah, it in my world we call those HQQs, high quality questions, which is, yeah, fantastic, because it gets people thinking a bit differently instead of talking about the weather.
Yeah, I mean, we can do that as well, but
Yeah.
let's keep it focused around that.
Yes. So
So I guess something that's,
I was just going to say, yeah, tell me more.
tell you more. So I think something that is then maybe interesting to consider when you're looking at lifestyle medicine, we have the luxury of having a lot of time with our patients. So like I said, lifestyle medicine is predominantly being practiced by GPs, predominantly by NHS GPs, who have between 5 to 10 minutes with a patient. So within those 5 to 10 minutes, they run the fastest analysis that you can think of. They try to implement some behavior change, and they have some success. But I would argue, because of the time that we have, we can actually have a really huge impact. They are bigger educational pieces that we can do with our patients if they inquire some more information, simply because we have more time with them. So health span and longevity, they are the two buzzwords at the moment, and obviously something that we are very interested in. And within MSK Care, I would say the 4 key pillars that we would look at is definitely bone health, because it doesn't get enough attention, joint health, muscle health, and then cardiovascular health also fits into that. So most of your listeners will know the statistics about a neck or femur fracture above the age of 65 carries a 20 to 30% death rate within a year, and then an additional 50 to 70% death rate within 5 years. And it's not because of the bone fracture. It's more around if your bones have been so brittle, that means your muscles most likely are quite weak. And if your muscles are weak, most likely you haven't exercised your cardiovascular system as well. Hence, that is weak as well. So the thing that excites me the most at the moment in terms of our profession or manual and physical therapy as a whole is how we could evolve from reactive rehab and pain specialists towards more proactive health coaching. And what are all the tools that are available to us at this time to optimize those coaching for our patients?
I think that's brilliant. I really do. That's a bit of thinking outside the box, which I love. Like that's what I do with clients, is like look at all their skills and go, what else could we do with these skills that would be useful to the community? And that's exactly what you've done there, is look at the bigger picture and say, how could we make an impact on people's health before they get to some kind of desperate state where they've injured themselves or they've got something chronic going on. So I think that's great.
Yeah.
And what else can you see you can do with that? Have you got other ideas on as well?
In terms of lifestyle medicine or in
Yeah.
terms of our approach?
Well, either. Yeah.
I mean, we have looked at a way of digitizing what we are doing, because the realization was that the way that we are doing it, it's great. We're reaching one-on-one people, but we can't really scale that to a bigger group. One of the big themes within lifestyle medicine is actually health inequity and health inequality. And I wonder if some of my colleagues have struggled with this as well. I remember so clearly when I left college, I had this thought about, I'm going to make osteopathy available for everyone. And I think it took me a couple of years until the penny dropped and I realized I'm working in private health. I don't work in public health. I will never deny treatment to anyone based on financials, but there's a whole cohort of patients that would never even think about coming to see someone like us. So the idea then was around building a digital tool where through the tool, access could be broader to more people.
Yeah.
That was the initial thought, but it's now moving in a different direction.
Oh. Will you tell me more about that?
I'm happy to. So essentially, what we are creating or what we have realized is one of the big problems that we have as practitioners is patient churn. And depending on clinic, depending on profession, that can be up to 70% of patients that don't complete their entire rehab plan. And for private clinics, that can come up as a loss. We ran analyses of this, £3 billion in the UK alone. But what we all understand is that our clinic profits are actually directly related to patient outcomes. So it's really thinking about, well, how can we optimize patient outcomes? What are the things that are driving patient churn? And the reality is that sometimes the pain journey or the rehab journey naturally slows. But as the journey slows, patients become a little bit unclear in terms of where they are plotting on the current scale. Are they still progressing? And then one of three things happen. Either patients go elsewhere to explore someone else. Patients might drop out and move towards chronicity and develop more chronic pain because they are not able to fully resolve the issue that they have. And that is really what we're working on with our technology to improve patient engagement. And we do that through various verticals. We integrate computer vision technology, we integrate lifestyle data from wearables, and we bring together a whole load of essentially health data that is very fragmented within our field of MSK care, analyze that, and then highlight trends to the treating physician. For us, what is very important is to keep the osteopath, the physio, the chiropractor as the human in the loop. So many technologies are being developed in this field at this point in time. Germany is a front runner, obviously America is a front runner, and many of these technologies are being developed without the necessity for any human. And then it makes us think, how is that going to reflect on our future as practitioners?
Yeah.
I would say us as osteopaths, we're fairly safe because obviously we provide manual therapy, and humans will always enjoy the touch.
Yeah.
However, once these shiny new technologies are going to be more established, especially within the NHS, I think there might come a point where we're going to find we're not only competing with our peers in private health, there might actually be a point where we're going to compete with public health as well, because some technologies are going to get that good. And it would be great for everyone to look at how many great tools are out there. I mean, many of us are loving Heidi Health. It's been transformative for us, not needing to write notes anymore. That's brilliant.
Yeah.
And there are so many great tools out there.
Very true. And it's interesting you saying you think you could end up competing with the NHS there as a result of the amount of technology they're using. But
I think it's difficult to make a prediction. And we all know NHS moves so slowly and there's so much red tape. But yet there is a very long-running pilot that is already running with NHS Scotland with, I believe they're called Flocker Health, and that is digital physiotherapy, but it's computer vision led. It has high success rates. It has high customer satisfaction rates. And I think each one of us as a profession within our own clinics, we really need to think about how do we stay relevant. And it also depends on who your patient cohort is. I mean, 40 to 50% of the adult population in the UK is wearing a wearable now. Yeah. I have patients that come in and they show me the data, not knowing that I know and that I work with this, and they ask me to look at it and do something with it. They also come ready with a spreadsheet from ChatGPT that had spat out its diagnosis and its treatment plan. And speaking to colleagues, there seems to be more and more of this happening. And I think many of us are not well versed in interpreting variable data and how that relates to recovery. And hence, this is one of the reasons why we've created WellQ to make that easier for practitioners.
Yeah, amazing. Yeah, I think things are moving so quickly. I know that it will be quite overwhelming for a huge number of the profession, because I hear all the time, oh, Gilly, I'm a Luddite, I'm a dinosaur, I'm a technophobe. And so the very idea of this will have them running for the hills. So is it just, I wonder whether it's just a fear of what all this stuff is, and is it easy to actually teach somebody how to interpret this kind of data and use it as information for part of the resulting treatment plan?
Yes. I mean, that is essentially, that is the idea. It is super simple to look at it. I think what I would say to those that feel that they're more technological dinosaurs, that is also okay, because probably the patient cohort that they will attract are maybe also people that are not necessarily so tech savvy at the time. But I think especially people that are young, that are starting out in the profession, I would really encourage them to look to become a bit more tech savvy in that space, because it is definitely where physical and manual therapy is evolving towards to. I mean, arguably, possibly, let's say a rural clinic in Wales is going to have a very different clientele to a central London physio clinic, for example.
Yeah.
And is the farmer in Wales going to wear a whoop? Maybe they do, maybe they don't. But the majority of people in the city clinics, they do wear some kind of wearable, or they do track some kind of metric, be that through their Apple Watch, or they have an Oura Ring, or even just in their smartphone.
Yeah. Yeah. I mean, I've got neighbors that work from home, same as me. And I find it hilarious that we've got a longish corridor outside. They're opposite me in our little block, and he says, if I'm popping out and they're walking up and down, I'm like, what's going on? I'm just upping my steps for the day, and it's raining, so I don't want to go out. So they just walk the corridor up and down, up and down. It's just wow. I don't think it would have occurred to me to do that.
I don't think it would occur to me too, because I go out come rain, come shine with the dog. The dog needs to go out.
Oh,
So
yeah. So you go anyway.
I go anyway.
Yeah.
Speaking of steps, there's this really interesting concept about the 358. Have you heard about that?
No.
About when we make recommendations to patients in terms of what would be a good way to recommend optimum exercise to a patient. So the exercise, that's what I meant to say. The idea is that you should have 5 exercise sessions per week. 3 of those should be strength-based, and you should aim for 8,000 steps per day.
Wow.
So those exercise sessions, they can be short, right? So we know that the guidelines are 90 minutes of vigorous exercise or 150 of moderate, and to have that combination of strength, cardio, and to implement something within balance. But generally, if you look at the 358, that's a good benchmark to kind of work with. And historically, I had always looked at, well, I need to go and I need to do an hour of swimming or an hour of cycling, an hour of weight training. And the reality is, I mean, my time frames are now snippets of time, and anything is always better than nothing. So yesterday I did 30 minutes of swimming followed by 10 minutes of sauna. The day before, I did 25 minutes of cycling, then popped to the gym and did a little bit of weights there. And at the end of the week, it will all accumulate together with all the steps that we do as well.
Well, that's a good way of looking at it, because it's not quite so rigid, is it? Like you say, you can just do what fits into your day, and by the end of the week, you'll pretty much have got there, or whatever, got over.
Yes.
Depending on what was going on. Fantastic. So, what else are you doing to innovate in clinic at the moment?
We have a pretty cool machine at work. We have a specialized bone health clinic. So within our clinical setting, we have acolyte that come into our clinic and they do bone density scanning. And depending on what the results of the bone density scanning are, we offer a rehab program to improve bone health. So in terms of bone health, we know that from the age of 30, we lose between 8 to 10% of bone mass per decade of life.
Goodness.
What is really cool about the bone, and unfortunately, Gilly, the two of us, postmenopausal, even more. What is interesting about the biodensity machine is osteogenic loading from high intensity resistance training. And the research papers have shown that it can increase bone density by 7 to 9% within 9 months. It's an interesting program that we run. It's a weekly session. It takes 15 minutes. Essentially, it is 4 short exercises that the client does within the machine. And I think clinically at this point in time, that is actually the bit that excites me most. Because we don't talk enough about bone health. I think it's slowly coming out in the media and slowly people talking about it more in the context of menopause as well.
Yeah.
And I think rarely am I seeing people talking about reversing bone density issues. And here we have a real solution. So beside the machine, we also then put together resistance training that people can do individually within the gym, the nutritional support that goes with it. And we're in the process of creating small group settings for people that are on the program to actually work together on a strength building program as well.
That's really cool. Yeah, so
It is.
To do it together is going to be, a bit more interesting than just doing stuff by yourself, which always was, to me anyway, is always a bit boring.
Absolutely. Actually, if it is of interest to your listeners, the next time when we have a bone health event coming up, they often happen on Zoom. I could share that with you, or I can even share it with you personally, Gilly.
Yeah, that would be amazing.
Have a listen into it. It's really interesting. It kind of like outlays the whole idea around it, the pathophysiology around what it is that we're doing, how it's working, and the research. So it's quite interesting.
Yeah, well, let's put that in the osteopathy works group when that's happening.
I'll let you know.
Yeah, that would be perfect. Absolutely fascinating. Well, thank you so much for talking to me today, Anna.
It's been a great pleasure.
I think it's really fascinating to see where technology could be helpful to osteopathy and manual therapy generally, and not to be scared of it, but to look at embracing it and incorporating it in to give you more information and allow you to create even better plans for the patient. And I love that you begin with what do you do for joy?
Absolutely.
Thank you, Anna.
Thank you, Gilly.
Thanks for listening to the Osteo Business Podcast. Remember to like, follow, and subscribe on all Gilly's channels, which can be found in the show notes. Gilly's back soon with more tips, ideas, and strategies to build your thriving practice.